Hello, let's talk about retraction cord placement. It's a small thing, but it's very important. We're starting with hemostatic agent in a dapping dish, and this is 00 ginger plane Z-twist cord. And then this is a Pascal PT55DE instrument. And you'll notice as I'm placing the cord, I've first placed it in the hemostatic agent and then just dab it off with a cotton 2x2. You don't want it soppy wet, you just want it damp. You always want the cord to be damp, and you always want the tissue to be damp so the tissue doesn't tear. And when you use this instrument, actually push the cord toward the tooth. Don't push it this way, and you're not trying to jam it way in there. You just want to reflect the coronal part of the sulcus. And once you get it going, stay there. Don't go, try to stay with it and push toward the tooth and just go just under the tissue to reflect the coronal part. And this is on the palate. I'm not pushing real hard. Now these teeth had crowns on the teeth and I cut the crowns off. And so this is after a little bit of repreparation. And these are full crowns that were on the teeth when the patient came to see me. And this is a tooth that we had to extract. And so there's an implant placed here. We're going to do taking a closed tray impression for an implant. And then these crowns here in just a minute. Press toward the tooth. You're actually pressing the cord into the tooth, and you're not trying to jam it way in there. You just want to put it under the gingival line so it reflects that tissue, so the impression material can get to the margin of the prep. I don't ever try to prep more than about halfway into the sulcus, no more than about 1 millimeter subgingival on the facial, and no more than 0.5 millimeter subgingival interproximally. So not a lot of tissue. You want to also be careful you don't strangulate this papilla. If you have a lot of pressure on the cord on this tooth and this tooth, you can strangulate that papilla, especially if you leave it in there a long time. You don't want to leave it more than about 5-10 minutes at the most. Okay, so there's retraction cord placement. That's the Dental Minute. These techniques work, and they work every time. Click on the blue link in the description below to register for dentistrymasterclasses.com if you want the very best videos. There's an organized library of all the Dental Minute videos, plus many complete comprehensive cases not seen in the Dental Minute videos.